call up our next speaker, Dr. Mayuri Pathak.
Good morning to all. My topic for today is comparing clinical outcomes of different EDOF IOLs. EDOF IOL is a new technology in treatment of presbyopia correcting lenses, and it primarily improves intermediate visual acuity, which is useful for computer work, while providing good distance vision. Based on IOL technologies, it is grouped as spherical aberration based, pinhole effect, wavefront shaping, diffractive and refractive types. They bridge the gap between monofocal and multifocal IOLs and cause less unwanted optical phenomenon like glare or halos than the multifocal IOLs, and offer improved contrast sensitivity. The aim of the study was to analyze visual outcomes after bilateral implantation of 3 EDOF IOLs, that is Vivity, Eyhance and Magnificent. Objective was to assess the binocular uncorrected visual acuity for distance, intermediate and near, to assess clinical performance of each IOL by measuring the contrast sensitivity and photic phenomenon by dysphotopsias questionnaire. Patient satisfaction was measured with the help of visual function questionnaire and Presque questionnaire. It was a retrospective study conducted at Lakshmi Institute, Panvel for a duration of 12 months, and the total number of patients included was 67. All the patients 18 years and above who were diagnosed with bilateral cataract and underwent elective cataract extraction with IOL implantation by phacoemulsification were included. Any patient with irregular or asymmetrical astigmatism, presence of any corneal, capsular, zonular and pupillary abnormalities, any retinal or optic nerve pathologies, intra and post-operative complications were excluded. Post-operative data abstraction was done, and binocular uncorrected and corrected distance, intermediate and near visual acuity was measured at 1 month, 3 months and 6 months. Binocular defocus curve and contrast sensitivity was also taken at each visit, and the 3 questionnaires were taken at 6 months. So the results, binocular uncorrected visual outcomes for distance showed that all 3 EDOFs gave satisfactory results of 0.18 logmar or better, and out of the 3, Vivity showed better results with 0.04 logmar at 3 months and 6 months. All the 3 IOLs gave decent intermediate vision of 0.3 logmar, which was constant over 6 months, and out of the 3, Vivity gave better results with 0.2 logmar, which was statistically significant. Vivity also showed near vision of 0.4 logmar, while other IOLs showed lesser acuity. The defocus curve at 6 months for all the 3 IOLs showed that Vivity had the broadest defocus curve, extending from +1 diopter to -2 diopters, which translated to a near add of 1.25 diopter. The clinical performance for all the 3 IOLs showed that majority of the patients did not have any photic phenomenon, and out of the 3, Vivity group showed better results, which was statistically significant. All the 3 IOLs gave decent contrast sensitivity, which was comparable to that of monofocal IOLs, and no significant difference between the 3 were seen. Coming to patient satisfaction, most of the patients in all 3 groups said that they did not need glasses for intermediate vision, and majority, that is around 80% of the patients, were comfortable without glasses and never or only occasionally had to wear glasses for intermediate vision. Most of the patients were either extremely satisfied or satisfied, and none of them were disappointed or distressed in either of the lenses. And according to Visual Function Questionnaire 14, it gave good patient satisfaction with a score of 99 out of 100. So to conclude, visual outcomes for all 3 EDOF IOLs give satisfactory distance visual acuity, decent intermediate vision for routine life, and out of the 3, Vivity showed better intermediate vision with a wide defocus curve and had the least visual disturbances, and contrast sensitivity for all the IOLs were comparable to that of monofocal IOLs. Patients implanted with EDOF IOL had high self-reported levels of satisfaction along with substantial reduction in spectacle dependence. Thank you.
A very nice presentation, but do you think spectacle dependence is an universal thing, and or is it a customized phenomenon? I mean, it varies from individual to individual. Demand for good near vision, demand for good intermediate vision, it varies from individual to individual.
Yes, sir, but cataract surgery is now.
So most commonly we compromise as a cosmesis.
Yes, sir. So for the people who want spectacle independence, previously the option was only monofocal IOLs, which caused visual disturbances and glares and halos. So by using EDOF IOLs, they give good intermediate vision and decent and somewhat good near vision, and that can without the photic phenomenon which is seen. So it improves the quality also as well as the spectacle independence. We had to compare all the three lenses work with different optical principles. So we wanted to see which optical principle in EDOF performed better, which we found was Vivity, which worked on wavefront shaping. Sorry. Huh.
So
uh,
they have not taken trifocals,
Yeah.
they have not taken monofocals, they have taken only the enhanced vision. Now this is a very small sample. 67 nowadays with having so many enhanced monofocals getting implanted. 67 is a very small one, but every small study has got importance, and getting that these are not. I mean, whatever the companies claim, actually everyone is same. That is also good.